All right, finishing up here. We were talking about historically poor compliance in mental health patients. So, if you're talking about doing a follow up clinic, obviously you want people to actually follow up. And that may be difficult with this population specifically. And you may have less patients who actually follow up than in some other nursing clinic or nursing follow up initiatives like with CHF or diabetes. Another threat would be just the general stigma associated with mental health diagnoses and treatment, um, both from patients who are embarrassed about their mental health diagnoses, but also from clinicians. Clinicians who don't really care, so they may not make the referral, or just want to get people in and out and don't want to take the time to really help these people. Another threat that I think is that established mental health providers in the community may perceive the involvement of the hospital, specifically case managers calling and following up on appointments for psychiatric patients, as a nuisance. In the discussion board, somebody had mentioned that services are so needed that people are going to be happy that somebody's doing something. And I do think that that is very true. I also think that anytime there's change in a system, somebody's doing something differently, there is a little bit of pushback from the status quo. And so I would assume that whether it's within the hospital organization or outside the hospital organization, there might be some pushback to a different or new approach. And just some final thoughts about my SWOT analysis. There's great opportunity and definitely an evidence need in Athens for mental health services. There's definitely a void, and I think that this would be a great intervention to help fill part of that. This clinic could provide greater coordination of care so patients don't fall through the cracks and they do get the follow-up that they need, and they do get connected with the types of programs that could really help them. Oftentimes there are opportunities and programs out there to really help people. People are doing a lot of great stuff in mental health, but the people who need it most sometimes don't know how to access it. Challenges inherent in working with the population of people struggling with psychiatric illness should not deter us from quality improvement measures. It can seem difficult, and many people have voiced that, it's going to be difficult to get follow ups. People may not be cooperative. A lot of this pushback happens, but just because there are challenges in this community, it really should not keep us from continuously trying to increase quality of their care and to work towards creating better outcomes for these people. I also feel that keeping patients from being admitted is not only a better outcome for them, but it's a cost saving measure that could really help improve margins at Piedmont Athens Regional. So it's multifaceted. If we can take care of these patients, it would be a better outcome for really all of us. And some of the statistics I used earlier in the presentation, these are the websites I got them from. Thank you.